Hello, everyone. A very good afternoon to all professors, doctors, and fellow students. Thank you for taking time to join us in this Ovid experience titled Abdominal Pain, a Patient Journey for Medical Education. I'm Dr. Olivia T. I'm the host for this session from iGroup. iGroup is a one-stop station for information products and library technologies. Our ability to provide a full spectrum of related products and services with localized support from each of our regional offices establishes us as the key information industry partner in the Asia-Pacific region. Today, we are delighted to have Mr. Alan Finn, who is the Senior Customer Service Technical Specialist from Wolters Kluwer, with us. And Mr. Alan has been active in Wolters Kluwer for over 20 years, and he creates many of the video and teaching tools and video guides for the Ovid content. Mr. Alan has a keen interest in training using video and interactive content. Today's webinar, we are going to be looking at modern video-based educational softwares, which offers standardized and evidence-based training on common patient care interactions. So let us explore how these tools actually offer a guided journey through patient examination, diagnosis, investigation procedures, and initial treatment with 3 resources. They are Bates Visual Guide to Patient Examination, Visual DX, being the second one, and the third one is Lippincott's Medical Procedures. All participants are encouraged to use the raise hand function. If you wish to ask a question, we can unmute you and you can speak, or you can choose to type your question in the Q&A tab, and we will attempt to answer all the questions at the end of the webinar. We also have good news to share. All participants who complete the feedback survey at the end of the session will receive a 1-month free access to all these 3 resources of your choice for yourself and your entire institution. So without further ado, I'll pass the floor over to Mr. Allen. Mr. Allen.
Hello and welcome. Just give me a moment to share my screen and then we will begin. My name is Alan Finn, and I'm here to take you through the process of using the, using these tools for medical education. And just as a moment of history for me, I can look back and think about when I first started in this industry and we were using medical textbooks, paper textbooks. Can you even imagine that? But gradually, the paper textbooks have been taken over by electronic full text. And today, as I work for the Ovid and Wolters Kluwer company, this probably makes up the largest amount of content that we sell, electronic full text journals, textbooks, and these sorts of things. But added into that mix, we also have emerging new sorts of content, which we're going to be looking at today. Medical education has also changed. Rather than people standing in front of a screen or a set of chalkboards and giving lectures, really what we expect today is to be challenged in different sorts of ways. We expect things like the flipped classroom, for example, where the students are given a task to learn about a particular type of medicine or medical approach by being challenged with a topic or a question. And it's this sort of education that we're looking at today. We're using this example of a student being faced with a challenge of a flipped classroom question about abdominal pain. What are they going to do? How are they going to rise to this challenge? This is the question that we're looking at today. And often when we are looking at information that is being used for medical education, not just in the materials that we're looking at today in these three examples, but even in our health libraries system, it's not just words, it's not just diagrams, it's not just pictures. Video is making a big splash as far as medical education is concerned, because you can encapsulate so much into a short video that is really hard to describe as a series of pictures or as a diagram. So it really helps to capture people's imagination, to engage them with video-based educational software. We're going to be looking at three types of software today. We're going to be looking at Bates Visual Guide to Patient Examination, Visual DX, and the very new Lippincott Medical Procedures. One thing that we expect when we use these types of electronic materials, though, is ease of access. So being able to link into this content really, really easily and quickly. We expect to be able to browse through it as if we're browsing through a traditional book or searching inside it. And if we're going to use it in that flipped classroom way of being able to set a task or ask a student to follow a scenario to explore a topic, we expect ease of access, a way of getting into it easily and exploring it in a very complete way. So let's begin to look at how we can use this exploration of a patient journey. Our student has been given a task of looking at this fictional patient with abdominal pain, and they're going to follow through that process as part of this software. So here we are in an exercise. Some students are asked to consider an adult presenting with abdominal pain. They're going to look at the resources which are available to them and maybe make some selections about the way that we might approach this topic. Perhaps they're new medical students. They have yet to actually have an encounter with a patient yet. So what they might need to do is to find out about how to examine a patient. What are the steps that we can use? And we're going to begin this exploration by looking at Bates Visual Guide to Physical Examination. And in an educational setting, being able to link to the videos and the video sections is important so that we can provide examples to the information that we want to guide people into. So this is Bates Visual Guide to Physical Examination. And this used to be a book. So thinking back into my past and thinking back to those very important books that people used to use, this was one of these, but now it is being represented as a set of videos within this very appealing context that we see here. I'm signed in with my account, but you could equally access this through a library website, a learning management system, or other method of access. And really, to make this easy, we can think about the three different ways that we may access electronic content, particularly when we're looking at it from an educational point of view. We may be coming in through an LMS. We may be accessing in through a library management system. We might be looking at this through a web page. We may be linking in many different ways. To be able to do that, if I show you here, this area within the software, this is the About section, which tells me about this content. And often these pages are free to look at. So these are public pages that we offer here. As a part of this content on this screen, it describes where this content comes from. This has been created by an individual author and her group to offer you information about the patient encounter, the sorts of things you might need to know if you were going to go through the process of examining a patient. And as a part of that, on this screen, we're able to see these individual URLs that are available to me behind this link. And what these will show me is that they will show me information about how I can link into the elements within this particular product. This product, Bates Visual Guide, as we see it here from this first page, is divided up into 3 sections. The physical examination is the thing that begins our journey. So this can be a place that people can come if, as students, they don't have any experience in exploring the process of examining a patient. So we can see here in these first 5 sections, this is about examining the whole patient, looking at an adult. This is our goal today, is to be able to examine an adult patient. We can see the process here of examining the patient as a total, and particularly looking at the abdomen here in this particular section. And if I needed to link into this, I would be able to make a link. And even here, we can see that URL. This is the URL that you would be able to use to come back to this screen. If I show you the features of this content, we can link into a specific part of this content here, or also here and here, and do searches for information that is about the physical examination of the abdomen. So we are not just limited to browsing through this content, we can also search within this material. So if we are interested in searching for how to examine the abdomen, we're able to do that. As a student, we may want to direct ourselves to a particular part of this content. We also have the opportunity not just to examine the patient in general, head to toe, but also to look at a particular part of their body in more detail. So we have several sorts of opportunities really to link into this content, to look at the content in detail, and we can notice that this takes us through the entire process. How the doctor or the student comes in and introduces themselves and establishes a rapport with the patient. How he's going to ask about the patient's individual health history. How we're going to go through the process of examining the abdomen in a variety of different ways. And we can link into any of these parts. So we're able to look, particularly if we need to, at examining the spleen within this particular section. The videos that we see here are offered with captions. So if you need to turn these on, these actually add to the experience because we're using a different method really of learning when we read and when we listen and when we watch. So by elaborating the different ways in which we can absorb information, it's more likely to stick, to be able to be recalled later on. So captions are a really strong part of the presentation here. And for some of the content that we see inside this particular product, there are also transcripts that we can download. So we can use the words that we find within this content to be able to explore that topic further. We can speed it up or slow it down. And maybe not here, but if we were looking at other products where we're seeing videos about different sorts of procedures, we may want to slow it down so we can actually see the great deal of detail that is captured inside of this video content. We can also zoom it open so that we can see the presentation in full screen. So we can fully explore the way that this is offered. There is narration with the content, and it takes you through the whole process. It doesn't just speak and allow you to listen. There are also diagrams and things on the screen itself. It will also take you through the process of not just examining the patient, but looking at the things that you need to record. So recording your findings is a part of this process. If I'm a student and I want to come back to this content, we can also place this as a part of my favorites, so that we can come back to this set of information again and again. Physical examination, though, is only a part of what a doctor or a nurse does as far as helping a patient is concerned. What they also have to do is they have to deal with the patient as an individual. They have to deal with them as a human being. And so if we look in this next section, this is all about communication and interpersonal skills. And this is an important part of medical education, not just knowing the process, not just knowing how to examine a patient, the steps that we go through, but how we can listen to the patient. So when we're taking their health history, we can actively listen to the content that they're giving us. How we can ask questions and draw out the information that we need. But if we are also providing instructions, if we want to persuade them that changing their habits is important to their health, then this is also a skill that we need to show. So thinking about the way that we talk to people, the way that we can persuade them is also important here. Perhaps a little later, when we're looking at this particular patient, the patient that's come to us with this abdominal pain, we're going to want to give them some advice about their life, about the way that they consume alcohol, for example. So we might be thinking about broaching sensitive topics, giving them advice about limiting their smoking, their drinking. We might be interested in responding to the way that they feel, because at the moment they have an abdominal pain. They may not be very receptive to our advice at that point. So we may be guiding them through this process. So being able to communicate, being able to relate to other people is an important skill, even as a student, as we begin to deal with the patients that we have on our books. Importantly, though, these two first steps are enhanced because if we come to this last part of the content, we're looking at these clinical skills videos. And these are presented not just as a process of testing whether people have learned what they need to, but also of looking at how we deal with an individual patient's problems. So we could be thinking about, well, we're placed in this situation where we have to think about a man that is presenting with abdominal pain. How similar is this particular example that we see here? Here we can see an example that is offered to us about that specific problem, that process that someone has to go through. And we see it divided up into its particular parts. As we look through this, we can see that this doesn't just deal with how we examine someone, it also deals with the things that we're thinking about here in communication and interpersonal skills. How we delve into their health history, the things that we are gathering about this patient, how we go through the physical examination. We've seen that in that first step. But next, how we think about what sorts of questions we ask next about this particular patient, how we go through the process, perhaps. So looking here, for example, at this particular section, these might be questions that we ask of the patient that we're interviewing at this point. And so this might be something that we want to think about when we are asking the patient to divulge the information that is really, in the end, going to help them through this process of dealing with their pain. So these are some of the examples that it gives as a part of this process that we're looking at within the Bates Visual Guide system. So we've gone through this process and we've thought about the information that we've been given as this challenge within this classroom environment. We have some other tools, though, that we can visit to really make some different sorts of judgments about this person and the problems that they are experiencing. I'm here in a very familiar place for me now, because this is often what I do. I teach people about the Ovid system, about the journals, the books, the databases that we have available to us through the Ovid system. We also have many other types of products as well. Products which are about anatomy, products which are about guiding people through evidence-based materials. And this is one of the ones that we see in this linking list. This is Visual DX. This is a diagnostic tool. And this might be the next experience that this student has moving through this process of really trying to imagine themselves as a physician, as a practitioner. What is it that they need to know? What are the tools that are available to them? And this certainly may be one of these. This is not just available as a desktop set of content. This is also available as a mobile device app. And so we can see the first step in that process of setting this up as an app on the screen just here. By creating a personal account, we can then begin to download Visual DX onto our own device and maybe use this as we're examining patients or as we are gaining experience within the hospital environment. We can begin to see some of the things which are available to us within this system. We can think about the different problems that are represented inside here. Many thousands of different sorts of diagnoses that we see through this tool, not just for adults, but also for infants and children. We can see that list beginning on the screen for us just now. We can also find out more about the company itself from these pages. So looking at video tutorials, finding out about the way that the software works, looking at many frequently asked questions about this content, or going back and beginning again with this material. Visual DX has been important to us through the pandemic because often during this time, people were using telehealth as a way of dealing with the distancing between us and our doctors, our nurses. And so a visual medium like this and being able to talk to someone through the internet and find out about your health problems has been really important for us in this difficult time. As a part of the process of looking at this material, what we may also want to do is to select the language that we use, and it is available in many different languages, as we can see here. So if you prefer a language other than English, this is certainly possible within this tool, and we can select our particular region, which is Southeast Asia, as we see it through the page just there. On the screen as well, it has some different ways in which we can begin our process. Visual DX has a lot of information inside it about dermatology and skin conditions, but it is certainly in no way limited to that particular area. The big benefit, though, of using Visual DX as a tool in that particular topic area is that we can actually look at the pictures of the skin problems that people may have gathered. So thinking about something like monkeypox, for example, this could be an important part of the diagnosis. There is an add-on feature as a part of Visual DX that actually deals with the visual appearance of the patient, which is called Derm Expert, where you can take a picture of a rash or a problem, and it will help you in the diagnosis of that individual issue. If I think that my abdominal pain is gastrointestinal in source, I could begin by pushing this button and starting my differential diagnosis with this first step. Or I can begin by typing in my observation of abdominal pain. And so we're able really to begin our process by thinking about the thing that is most important to the patient. They have this acute abdominal pain, and we're trying here to help them. We're trying to begin to find out about the issues that they're having. if we can draw from them some further information about the type of abdominal pain that they are experiencing, we can choose one of these other choices. If we think that this is a drug adverse effect, we can begin to push our diagnosis into that direction. We have chosen, though, the thing which is most prominent about about this particular patient. They're an adult. They have this severe abdominal pain. They are of a particular age group. They are a man. So we've really begun by looking at the things that we can see in front of us. We can guide further that exploration of abdominal pain further if we need to by choosing from the buttons that we see. We can tell and experience that this patient has nausea, that they have vomiting. If I'm not sure about the meaning of some of these options that we see here, you can see that the information icons gather other explanations about the choices that I can make. It's guiding us through the process. We don't need to choose from each of these menus if we don't need to. We are gathering, first of all, the initial response to the process that we see in front of us. The patient has only recently begun to suddenly exhibit this abdominal pain. So we're able to choose from the choices that we see on the screen. How do they look? They look pretty sick, I have to say. We can go through the process of seeing about the types of problems that they are experiencing. I know because I can almost see it that the patient's heart is beating very rapidly. So I can select tachycardia as a part of this process. We're moving through, and as we're selecting, we can see the choices that are appearing here as our observations or findings. And the one that is tagged in green is the one that is required. It's the principal one. It's the one that really characterizes this whole experience for the patient, their extreme abdominal pain. If we have other options that are available to us, if we have some lab findings, if we are knowledgeable about the patient themselves, we can make some choices about what we find in front of us. Has the patient just returned from holidays in an exotic location? We might know about something that is here in front of us. You can notice as well that in addition to the prompts that we see, we also have a way of beginning to type the information in from the top of the page. So perhaps we know or we have experienced before that the patient does drink and perhaps they also smoke as well. So I can begin to type in perhaps that this patient uses alcohol. This is also something that we could have entered from here as well. So the sorts of options that are available to us about substance abuse are here as well on the screen. So alcohol use is definitely a part of what we're going to look at for this particular patient. What we've done is we've gathered up the information that we see in front of us, and we can refine this later on if we need to. The thing that we were doing here was we were thinking about this as an exercise that the student was given as a part of a flipped classroom experience. We've moved into patient examination as a process, and we're thinking about that as a process as we move through the patient encounter and the way that we can simulate this area of this experience that the student's having. At this step, more information has been revealed by the patient on their condition. We've examined them, but we've also spoken to them. And this is something that we see in the doctor's notes here. What we may be thinking, though, is what further information could be required? What are the next steps that we can take as we're moving through this process? What we can see as a part of this process, as we begin to view this differential, is we're seeing the sorts of things that are being suggested as a part of this process that we see here. All of the items that we see here are indicated by the selections that we see here across the top of the page. So we can hold our cursor above the materials that we see here, and we're able to see a response about the findings and how they match in with the particular problems that we're seeing described here. What we're seeing as well through the medium of this particular presentation is information about which ones of these problems are difficult and life-threatening situations by using the medium of showing us the colors on the screen. It's showing us information about the feedback that we're seeing about these individual problems that we see. And what we see, first of all, is we see something that is called a sympticon, a summary of the symptoms that are about that particular problem. So we're looking across this list and we're thinking, oh, yeah, well, this one may be good. This one also may be good. But what are the extra questions that we can ask? What are the additional observations that we can add to our choices, really to define what is going on here? Are we going to find out whether they are experiencing an altered mental state? Do they have back pain? Do they have shoulder pain? The sorts of things that we see here could be helpful in our observations. So perhaps we are returning to the patient and the virtual patient at least, and what they tell us is that there is back pain, so that we can add that to the list. And we can see here that there is a prompt that leads us through the process. Is it upper, is it lower, or is it not indicated in this case? And the thing that we can perhaps see is that perhaps pancreatitis is something that is indicated by this particular pattern of process. This sympticon gives us some more information. Perhaps it also will guide our further examination of the patient. It indicates here that the pancreas particularly is inflamed. So perhaps this is an observation that we could make. This product is evidence-based material. So the summaries and the content that we see here has been gathered based on many different observations and a summary of many different patient encounters over many years. They have been created and written by experts in this field. You can see the contributors listed here. And something that is a strong part of this content is the visual nature of the material that we see here. So we may be looking at illustrations of the patient's appearance. We may be looking at scans and x-rays and other materials that are issued here as a part of this content. And so perhaps, since this is a potentially life-threatening emergency, if this was in a hospital situation, we might direct the patient to some sort of scan, and we have the ability then to compare this information with the images that we see here as a part of this display. We can open them up. We're able to see the captions and the materials which are here, and make some sort of quick definition of the content that we see as a part of this list. This is a summary that we see here. So it begins with a synopsis, why this is so important, and the issue that we see here gives you some summary of how likely this is within your particular environment. We can think about the different causes of this problem, whether it's an infection, whether it is gallstones and those sorts of things that we see on the screen, and maybe some ways in which we can tell that this is or is not this particular problem. Ways that we can perhaps see things that we can look out for, things which are useful in our differential diagnosis, and what may be other sorts of issues and problems that show similar sorts of patterns of symptoms. If we're here, we're probably thinking about how we can further test for this problem. What sorts of images and other items are useful for this particular problem. As a part of this problem, though, we may be thinking about therapies. If we have access to other information, we can zoom off to up to date and be able to see further information about that particular item. We're also able to find out more about the sorts of things that we can do for this particular patient in behind the links that we see here. As a part of this process, though, we would be thinking about the steps that we see here, about managing pain, about giving the virtual patient that we have some fluids, about thinking about their later life and whether we need to deal perhaps with their drinking as an issue. We may also think in the more near term about how we are going to deal with their pain and discomfort. It may not be possible for them to eat, and so we need to make some sort of other arrangement for their nutrition. And we can see that in this part. It may be that there are obstructions. This may be the cause of the pancreatitis, where there may be other issues that we have not yet encountered or dealt with, that we need to encounter and deal with as a part of this problem. So looking perhaps at the next step, if we have gone through this process, perhaps we are then thinking about how we can deal with this particular patient, this virtual patient that we have presented to us, and we can think about the management of this particular issue. And we may be looking at management through Visual DX as a diagnostic tool, or through the medium of Up-to-Date, which gives us further detail and allows us to see more about this particular issue. As a part of this virtual patient's treatment, though, even in the short term, nutrition and fluids are an issue for this particular person. Symptoms may prohibit normal eating, so nasogastric feeding may be something that is necessary for the person even in the short term. As a part of this approach to their treatment, even in the short term, we may be wondering about the sorts of procedures that this patient may undergo. And as a part of wondering about those individual issues, we may be coming to a tool, a video tool, which is available here. This is Lippincott Clinical Context. So we have seen through Bates Visual Guide and through Visual DX, which contains visual information and also in some cases video. And we're looking here at Lippincott Clinical Context. These medical procedures that we see here are the 80 most frequently used procedures to demonstrate to medical students. So these are the ones that they are most likely to encounter, the ones that they may frequently need to be taught. We can approach this in many different ways. We can begin by searching, if we wanted to find out about whether a particular procedure is available within this particular package. So we can begin to open up and see the individual procedures which are a part of this content. So searching, browsing through the content that we see here, and also linking, because as you may expect, we can link into this. We can link into this from a learning management system, from a catalog, from a web page, and we're able then to easily access this content. Both Bates Visual Guide, Visual DX are evidence-based materials. We also find this here. This is based on the work of individual experts, but these are also supported by references that show us where this information comes from. On the screen, we can see one or more videos, depending on the procedure that we're looking at. And this takes us through the process of placing a nasogastric tube. And so as we scroll down through this page, we're able to see access into those videos and the reason why we may need to do this. We're able to see the equipment that's necessary. And we can take this out as a list. So if we're using this as a preparation for a demonstration, we would be able to gather those individual pieces of equipment and content to be able to go through this process and demonstrate this individual procedure. We can look at the key steps and link into them. So we're able to see those individual sections of the process. And as you may expect, each of these is individually accessible. And as we open up that individual part, we're able to see how this works. We have closed captions in many cases. We can open this up to full screen. We can hear the process. We can slow the process down if we want to capture the detail that is available to us here. So by using this video medium, we're able to really capture in great detail the process of performing this task, of doing this procedure, and being able to see the issues which are perhaps faced by this, by the treatment of this individual patient with their problems and their abdominal pain, their pancreatitis, and we're able really to see the sorts of problems that are associated with that individual item. We can open it up to see more detail. We can view the references that are associated with the production of this content, and often we can link off to them. And if we want to see a summary of the individual steps, we can see that as part of the medium that we see here. Well, for me, I think, and I hope that we have looked at examples of some visual and video-based content, and we've looked at how this may be used in education. So we're able really to think about the details of each of the steps, how a student might go through the process of experiencing something, of solving a problem, or looking at an issue that they may encounter in real life later on, by using these sorts of tools. And these tools are definitely used in this way in medical education. The different sorts of approaches are definitely used in an educational process. We're looking at how we can use them. We can link, we can search, we can browse. We can actively use the content that is inside this material. And of course, this is just a small part of our larger catalog. We're thinking about the health libraries, the Lippincott Suite, and the many journals and books that are available from Ovid, Wolters Kluwer, and from our wonderful partners at iGroup across the region. I'm looking at the chat to see whether there are any questions.
Yes, Alan, I think in the Q&A tab, there is one question, yes, which says, how do we share the findings with other users?
Okay.
Pertaining to findings as in
Visual DX, for example.
right.
Yeah. It is possible to capture and print from the tool, but obviously this would really more likely apply to the desktop rather than the app version. Not sure about that. I will have to explore that for you. In this circumstance, if it is being used perhaps in a classroom or a workshop arrangement, I don't know that that necessarily would be necessary, but I could imagine if we were using this in real life, that you may want to share your findings with others. I will have to think about that. There are definitely, if we look back at this set of screens that we see here, if I look at the top, I can definitely take out the information that we see here by printing it. And as with most systems now, print doesn't just mean putting it on paper. It can also be transferring it to PDF. Yeah, so that would really be my message, would be perhaps that you could capture it as a PDF and send it off to someone else. The other thing that we didn't look at, which is definitely available for us here, is patient handouts. And in that circumstance, we can definitely email those.
Right. Thank you very much, Alan.
Okay.
Are there any other questions from the audience, please? Just to highlight for everyone, all participants who fill in the feedback survey questionnaire, which you will get at the end of the Zoom webinar, will receive a 1-month free access to these resources that Mr. Allen has very clearly demonstrated to us. You will get the access for yourselves as well as your entire institution. So we'll follow up with those who have provided the feedback. And for those who are interested to contact us or to find out more about these resources that Mr. Allen has just demonstrated, you can contact your regional or country sales office, and these are the contact details of our representatives there. Before we close, Mr. Allen, would you like to make any closing remarks? Yes.
I would just like to say thank you very much to you and to my wonderful colleagues in iGroup as well. We have been working closely with our contacts across Southeast Asia in iGroup, and can I just say that they are wonderful partners with us in our endeavors really to help with the health and education of our populations across this region. So thank you very much for the opportunity today, and I hope at some point to see at least some of you in person. That would be really, really nice.
Sure,
so
yes.
Thank you very much.
Thank you, Mr. Allen, and thank you to all participants who are here today. You will receive the recording soon after this, maybe in the next couple of days, with the feedback link as well. But do fill in the feedback if you can after this webinar. Thank you again, everyone. See you again.
Thank
Bye.
you. Bye. Bye.